We're giving folks just a minute and then we'll get started. Hello, everyone. Thank you for joining us today. We're glad you could take some time out to join us at the Centers for Medicare and Medicaid Services, Office of Minority Health, to hear some more about our Minority Research Grant Program and to join us for this application assistance webinar. Before we dive in today, I just want to share a few updates of the purpose of the webinar. The Minority Research Grant Program application assistance webinar sessions are designed to provide additional assistance by providing background information, as well as some firsthand experience from a previous grantee who can talk about their experience and answer any questions that you might have for CMS or for a previous grantee. We hope that today's session will be able to help you get more familiar with our program, especially as you consider whether your institution would like to apply this year. Joining us for today's webinar is Dr. Veronica Ajewole of Texas Southern University, and she is one of our 2020 grantees. She will speak about her institution's research and share experience applying for the grant. We'd like today's session to be an opportunity for you to learn more about the grant program broadly, but also from the perspective of a grantee who was previously in your shoes. We can go ahead to the next slide. Here's our agenda for today. We'll begin with an overview of the Minority Research Grant Program, which you'll hear us call MRGP, followed by the presentation from Dr. Veronica, details on the 2023 Notice of Funding Opportunity, including eligibility requirements and how to submit an application via the grants.gov website. Following these items, we'll conclude with some time for questions from the audience. On the slide, we also have instructions regarding accessibility for today's event. To access the live transcript feature, go to the menu at the bottom of the screen and click the live transcript icon. After you click the icon, click on View Full Transcript, which will allow closed captioning to appear at the bottom of your screen, and the transcript will show on the right-hand side of your screen. We can go to the next slide. Before we dive into this overview, we wanted to provide a bit of just a little background on CMS as a whole and our office in particular. CMS is the largest provider of health insurance in the United States. It's responsible for ensuring that more than 160 million individuals that are supported by CMS programs can get the care and health coverage they need and deserve. Our office, the Office of Minority Health, is one of 8 minority health offices within the larger Department of Health and Human Services. We serve as a principal advisor to CMS on the needs of minority and underserved populations. And that includes racial and ethnic communities, people with limited English proficiency, lesbian, gay, bisexual, transgender, and queer persons, persons with disabilities, those who live in rural or geographically isolated areas or the territories, and persons otherwise affected by persistent poverty or inequity. We can advance to the next slide. We'll give a brief overview of the Minority Research Grant Program before I turn it over to my colleague. Go ahead to the next slide. So again, you'll often hear us call this MRGP. If you see that in our announcements and things, that's what it means, Minority Research Grant Program. It's administered by our office, CMS OMH, to support researchers at minority-serving institutions to explore how CMS can better meet the healthcare needs of the populations we serve. In addition, the grant program supports CMS's efforts to advance health equity by increasing understanding and awareness of health disparities, developing and disseminating solutions, and implementing sustainable actions. We can go to the next slide. The program's been around for about 20 years. CMS has provided grantees with funds to further health equity research that support researchers pursuing topics that impact minority populations, investigate the root cause of health disparities, and foster dissemination of research within the CMS programs. And this grant program gives our communities the opportunity to benefit from the research as well. It's a fantastic opportunity for minority-serving institutions and health equity researchers to grow their work and their own portfolio. All right, we can go to the next slide. So we do have a short video to highlight the Minority Research Grant Program. And this is something that you can find on our YouTube channel if you are ever looking to play it for colleagues or others to help share information. And I believe we'll go ahead and watch it.
The Minority Research Grant Program helps researchers at minority-serving institutions like yours build a portfolio while funding studies important to the healthcare needs of medically underserved populations across the nation. As a grantee, you can investigate the root causes of health disparities, share best practices for reducing these disparities, and better improve the health of racial and ethnic minorities, people living in rural areas, individuals with disabilities, and sexual and gender minorities. Becoming a grantee allows you to partner with the Centers for Medicare and Medicaid Services, grow your research credentials, increase the public's knowledge on health equity, and share your findings to join the ranks of other Minority Research Grant Program awardees who have published dozens of manuscripts that have been widely cited. For over 2 decades, Minority Research Grant Program awardees have uncovered health equity barriers and solutions in the U.S. by addressing a variety of issues in chronic conditions and healthcare access. The Minority Research Grant Program strengthens the capacity of historically Black colleges and universities, Hispanic-serving institutions, tribal colleges and universities, and Asian American and Native American Pacific Islander-serving institutions, and helps widen the pipeline of researchers making a difference in disparities affecting minority healthcare. To learn more about the Minority Research Grant Program, eligibility requirements, and how to apply, visit go.cms.gov/minorityresearch.
Thank you, team, for playing that. So we'll go ahead and advance to the next slide. And at this point, I will turn it over to Brian Young of the CMS Office of Minority Health as well, who can get into a little bit more detail about the grant program. Brian?
Thank you, Ashley. Hello, everyone. My name is Brian Young, and I am a public health advisor within the CMS Office of Minority Health. Through MRGP, we set out to achieve several goals. The first is to develop capacity at minority-serving institutions to research health disparities and social determinants of health. This support for minority researchers helps them grow to a point where they can conduct research independently and be competitive for other major grant support and opportunities. We can go to the next slide, please. The second goal aims to understand the root cause of issues that lead to health disparities and identify repeated interventions. Institutions investigate these root causes by exploring local conditions and populations, specifically medically undeserved populations. We can go to the next slide, please. And lastly, the research funded by the MRGP uses various methods to broadly disseminate best practices for addressing health disparities, providing culturally competent care for all patients. CMS reviews these findings and best practices to strengthen CMS programs. We can go to the next slide, please. So I'd like to share a few summary highlights from the 48 grantees funded between 2005 and 2020 Minority Research Grant Program cycles, so that you can better understand the impact that MRGP has on the grantees and the grantees' research has had in the communities. The MRGP has funded a range of projects focusing on various populations that experience health disparities. Grantees from historically Black colleges and universities and Hispanic serving institutions have focused on health disparities affecting African Americans and Hispanics, respectively. Through research efforts from the funded grantees, we were able to see the impact MRGP has had. Many of the grantees reported disseminating their findings academically through peer-reviewed journals and conferences, as well as to the communities that they served or that participated in their research. The MRGP is an opportunity for health equity researchers to not only expand their research efforts, but also disseminate their findings through diverse methods. We can go to the next slide, please. We have funded health equity researchers at minority-serving institutions through the MRGP for over 2 decades, almost 30 years now. This slide shows our 2022 grantees, the Board of Trustees at the University of Illinois, Prairie View A&M University, and the University of Hawaii, who have all examined critical public health disparities. We can go to the next slide, please. Now I'd like to introduce our featured grantee, Dr. Veronica Ajewole, on behalf of Texas Southern University. Dr. Ajewole, you may begin.
Thank you very much, Brian and Ashley, for having me join the call today, and good afternoon, everybody. Please go to the next slide. Thank you. As rightly introduced, my name is Veronica Ajewole. I'm a clinical pharmacist by training from Texas Southern University, and I had the privilege of receiving this grant award in 2020. And I've just put on this slide a couple of pictures, more like a memory, a memory line of how, this all grant funding opportunity was received. Myself and my colleagues at TSU, we came across this RFP sometime around May of 2020. And if we all remember, this was in the midst of COVID. So it was really tough, for us to be able to, we're transitioning to working remotely and everything going on all around, kids all in the house. So it was pretty crazy, but, we were able to, pull all the resources we had together. And, we were able to successfully submit the proposal as seen in the second picture here. Oh, I missed the name of the grant. Okay. We were able to successfully submit the grant here in, in May, around the due time, the due date. So we came across the notice of award in, I would say maybe somewhere around March, April. Pardon me, and then we were able to successfully submit in June, on the 2nd of June. This particular award, was looking into aggressive prostate cancer, looking at, some of the causes from a data analysis standpoint, and also engaging directly with community members around initiatives on aggressive prostate cancer for African American population. And then the last picture is the day that, we got the real great news, sharing with us that our grant has been funded, from CMS funding agency. Next slide, please. And now I'm going to go quickly over the study background and why we decided to, conduct the study. Next slide, please. So prostate cancer disparity, several of us might be aware that African-American males do have a higher incidence of prostate cancer, incidence compared to Caucasian males. And unfortunately, several African-American patients also do present at a clinically advanced stage or an aggressive type of prostate cancer, which would, obviously lead to mortality, less survival, and higher comorbidities, higher complications down the line, and also increased cost, when it comes to the overall impact on healthcare. Early screening for prostate cancer improves the chance for early diagnosis and reduces morbidity and mortality. However, African-American men are less likely to screen early for prostate cancer. So this is more of the background, for why we were able to engage in this study. Next slide, please. Then specifically looking at the study, we set out with two aims. The first objective was to identify the key elements associated with aggressive prostate cancer among African-American males, and for us to create a social determinant of health-based interventions to potentially reduce burden of aggressive prostate cancer among African-American males. Secondly, we wanted to develop a social determinant of health-based interventions for aggressive prostate cancer among African-American males, and we wanted to do this through a community-based participatory research model. For us at Texas Southern University, we did not work alone. We worked in collaboration with with our study partners from Houston Methodist Hospital, which was where we did all the data analysis. We work in collaboration with Sankofa Research Institute and community work group led by Dr. Richard Asata. We worked in collaboration with our community advisory board, as well as our student interns that assisted with data analysis and review. And I do want to mention that, myself, along with my two co-Is, that is Dr. Uche Therefore, as well as Dr. Grace Loud, provided support from TSU side to be able to successfully complete this grant. Next slide, please. Then for the study variables, and this is where I have to, give my full disclosure that when we wrote the proposal, we had intended to perform the study over a 10-year period, looking at 2009 into 2019, keeping in mind that we submitted the proposal in 2020. So I wanted to do a 10-year snapshot, looking at population of African-American men with prostate cancer in Houston Methodist Cancer Registry, looking at demographics of age, race, ethnicity, zip code, anything that related to social determinant of health, be able to obtain cancer-related information, what's their PSA, what's their Gleason score, what was their stage at diagnosis, and also any comorbidities or medications that were previously reported to be associated with prostate cancer. This was where we ran into a little bit of challenges, right? Because, writing the proposal, getting funded, and now implementation was where we realized that Methodist Hospital transitioned into a new medical record in 2016. So everything that was in the medical record prior to 2016 became obsolete, and we were really not able to access that data. But what happened, even though it was challenging, I maintained an open communication, and I want to say thank you to Brian Young and Sean. Sean, both of them, I had meetings with them to really be honest and open and say, well, this is what's going on. We've gotten into a challenge here. How can we make modifications to the timeline of the study? One, and also requesting a no-cost extension, because it took, several months before we were able to access the data that we need from the database at the Methodist Hospital Registry. And, with them giving us guidance and with collaboration and support, we were able to successfully streamline the timeline to 2016 to 2021 and requested a no-cost extension that was approved, under the leadership of the CMS funding agency. Next slide, please. So this is the data collection plan, collaborating with Methodist Hospital. We did data query in the cancer registry. We were able to link this data with geocoded information so that we can obtain social determinant of health domain, looking specifically at area deprivation index, geocoding, and also medical record, so we can obtain additional information for each patient. Next slide, please. For the study timeline, including all the main key steps, that we went through on the study, we received our notice of grant award in late August, and then in September, we put in information for IRB approval. It took a few months. When we got our approval, we did, started off with data extraction, review, and analysis, and that was one of the reasons why we engaged our PharmD interns to assist with manual chart review for some information that we're missing in the medical record, based on direct data extraction. In September 2021, we were able to proceed with doing a community work group and initiating our community advisory board. And then September 2022, this was, at this point, we had requested a no-cost extension because of the time it took us to get the data, analyzed and finalized. So then in November of 2022, we were able to successfully host a community engagement conference to share findings of our study and also next step. This is really an anchor, opportunity for our program, because we just did not want to share information with scientific entity alone. We wanted to make conscious effort to share information directly with community members, with spouse, African-American men, and their support system when it comes to addressing health disparities in prostate cancer. Additionally, most recently in March, we went to the conference, Health Disparity Conference in DC, where we were able to present the findings of the study more in a scientific setting. And currently now I'm working on, finalizing the manuscript for publication and also preparing the final report that will be sent back to CMS in a few weeks from now. Next slide, please. So this is just an highlight of the conference that we had, which is titled Face-to-Face, Shoulder-to-Shoulder. Let's talk about prostate cancer, which we had in November of 2022. Next slide, please. So this is looking at the summary of the findings from the study. Like I said earlier, we had to truncate the timeline of the study from 2010 to 2019, which was the initial time frame. We had to shift that a little bit to 2016 to 2021. These are the key findings from the study from a data standpoint, finding out that older patients had an increased risk of developing prostate cancer, area deprivation index, people that lived in an underserved community had a greater risk of developing prostate cancer, use of medications like thiazide, like diuretics and angiotensin II receptor antagonists also showed a positive signal for reducing the risk for aggressive prostate cancer, while the opposite was what we found for direct vasodilators. Next slide, please. Then here I'm going to show some of the engagements that we had by receiving proclamations from elected officials concerning this conference, so that way we can continue stimulation, continue engagement, and continue our efforts when it comes to addressing prostate cancer disparity among African American population. Next slide, please. This here is showing some of the outputs that came out from the community work group and from our community advisory board, where we are now positioned to make very concrete plan to be able to increase awareness about prostate cancer, to increase advocacy, and be able to encourage men to take action, to screen early, and find out more information about prostate cancer in general. So all of this information are available on our website, and we continue to stay engaged with community members with the message of early detection saves lives, when it comes to prostate cancer. Next slide, please. As part of that conference, we also have the privilege of engaging with other funding agencies. This is ASAR. Steve Richards was able to do a recording on behalf of ASAR, sharing information and support for the work that we do. The video is about 3 minutes long, so I'm not going to play it, for the purpose of today's presentation. Next slide, please. And here also is a video from Sean Trotter from CMS, sending a message, back to us and to the attendees about the findings from our program. So again, just showing that we were able to network across multiple levels, community members, stakeholders, elected officials, funding agencies, that even though the funding time frame of the grant is wrapped up, we continue to put forth efforts in addressing, health disparity in our community. Next slide, please. And then now that we are, coming into 2023, September is Prostate Cancer Awareness Month. We continue to make efforts, using some other funding opportunities from other agencies and sponsorship to host another conference that will be in September 16th, same face-to-face, shoulder-to-shoulder. Let's talk about prostate cancer, focusing on early detection saves life. And the time is 10 to 2. This is going to be in an in-person with a virtual option when it comes to the format of the upcoming conference. Next slide, please. And I think that's really, you know, a summary of how we were able to receive the funding, the findings from the study, and the next steps that we have, you know, upcoming in the future. And I want to say thank you to CMS. Thank you, Brian, Sean, and everyone, you know, that supported us, especially, you know, during that data analysis time frame, quite stressful, but the support they provided was, you know, very helpful, that we got the no-cost extension and were able to successfully wrap up with the project.
Thank you, Dr. Ajewole, for your presentation today. So next, we're going to review the MRGP's Notice of Funding Opportunity. Next slide, please. So I'm excited to share that on May 11th, 2023, CMS OMH released the 2023 Minority Research Grant Program Notice of Funding Opportunity, or what we just say NOFO. We are now accepting applications via grants.gov, and the deadline to submit applications is Wednesday, July 12th at 3 p.m. Eastern Standard Time. This year, we can award 3 grants up to $333,000 each to eligible institutions. Next slide, please. Now, before we provide a demonstration on how to properly submit an application through grants.gov, I would like to go over some eligibility criteria and requirements. Next slide, please. So applications undergo a thorough review process, evaluating the level of innovation, community collaboration, and scientific rigor. To be eligible, researchers should focus on developing suitable interventions for health disparities impacting minority populations. Health equity researchers with suitable projects from the following type of minority-serving institutions may apply: historically Black colleges and universities, Hispanic serving institutions, Asian American and Native American Pacific Islander serving institutions, and tribal colleges and universities. So this year, just hot off of the press, newly eligible minority serving institutions who are able to apply this year are predominantly Black institutions, Native American serving non-tribal institutions, and Alaska Native and Native Hawaiian serving institutions. For more information on eligibility requirements, you can visit the program's webpage listed on the screen. We can go to the next slide, please. Next, we will provide a demonstration on how to properly submit an application through grants.gov. Next slide, please. So when you visit grants.gov, the first thing you will need to do is to click on Search Grants tab. Next, you will type the MRGP grant number into the opportunity number box and click Search. Make sure to include the dashes as they are part of the grant number. We can go to the next slide, please. So once you click Search, the MRGP grant number will appear, and you will proceed by clicking on the actual grant number. Finally, the MRGP, oh my gosh, can I say it? The MRGP opportunity will appear, providing more information such as the grant synopsis and eligibility requirements. Once you can completely read all the MRGP requirements, you will proceed by clicking Apply. Next slide, please. So we will now move to the question and answer portion of the meeting. You can submit your questions using the Q&A feature. We will answer as many questions as time permits. So are there any questions in the chat?
Everyone, just encouraging you to please feel free to put some questions in through Q&A and or through the chat, preferably through the Q&A because those are just easier to mark if we've gone through them so we don't miss anything. But the chat is open. So Brian, it looks like we do have one question so far in the chat asking about HSIs and eligibility.
So yes, Hispanically serving institutions are eligible to apply for the grant.
Great, thank you. And there was one other question about the grant made to University of Illinois.
Yes.
The name, I think they have a long title for their formal name.
I added it to the chat earlier, but it's called Addressing Disparities in Access to Transplant, the ESRD Patient Evaluation Clearinghouse.
Great. Thank you. So we have plenty of time. If you have any questions, this is a great way. There's some questions that are maybe too particular that we aren't allowed to answer during the funding opportunity. But Brian's been working with this program for a couple of years, or if you have questions for Dr. Veronica about her experience, we are happy to help. And there was one thing, Brian, I remember a piece of advice from our grants office last year that they gave somebody, which was don't use the deadline as the deadline. Pretend the deadline is much earlier, because I believe that there's, just one for planning ahead, and because it sometimes takes longer to actually submit it than you might think. And then I believe they said something about the, I'm hoping you remember this one, the person that actually has the approval on this institution's end, it might be the PI, even has to at some point approve or be the one to do something in that process. So just planning ahead and trying to make sure not just that you have your information and you're meeting the deadline, but there's a little bit of nuance to that timing, I think, right?
There are a few people from your organization who have to participate. Like you said, PI, and then it's like the AOR, the approving official for your organization. So you have to definitely collaborate with a couple of people within your organization to submit the application.
Yeah, and I understand that can, just like at CMS, it can take a little time.
Yeah.
Yeah, so don't wait until the day of. All right, we do have some questions that have come in through the Q&A, Brian. The first one, if we represent a consortium that includes minority and non-minority serving institutions, but we are collectively conserving the community, would we be eligible?
So if you were applying as a minority serving institution and were just partnering with a non-minority serving institution, that you could possibly apply. But if you're trying to apply from a non-minority serving institution, then no.
And I know in the past we've had people that have worked together to partner with somebody who is a minority serving institution, but then there's like some other community partner, some other researcher that they work together to do it. But I believe the minority serving institution does have to be the one to actually submit it, right?
Correct. Yes, Ashley.
Okay. Another question that came in, are there any specific evaluation processes we should consider?
That's more of an internal process, so we can't really share how we actually grade until after we actually grade all of the applications. Then we can provide feedback.
Yeah, I would just make sure that you read through the requirements that are listed on the NOFO, and the website gives a lot of information about past work that might help as well.
And please make sure that you include every single item that the NOFO has.
Yes, good point. All right, let's see. Dr. Veronica, I think there's one in the chat, if you don't mind. I'm going to read this out loud though, if you could. Thank you for coming on camera. Do you mind talking more about the process that you had applying and how it hopefully was helpful for your institution?
Yes, that's a great question. And yeah, I'll be glad to share, so again, it was a bit challenging because we were all transitioning to remote work, right? Like it was right in the midst of pandemic declaration. So from that standpoint, we were all off campus. So working remotely was a bit tough, but I think planning ahead of time, and communicating as much as possible with the Office of Research, telling them, hey, I have a grant due, this is the timeline, how quickly do I need to get all the paperwork internally so that they review and approve and have the AOR, the delegates, authorized signing official of the institution available to push the final button. Because I can submit on my side, I submit on my end, and the AOR, they still have to go in after me to make sure that everything is cleared and submitted. So that was, a learning curve, but I think, working collaboratively within my group at TSU, we were able to, walk through all of that. I hope that answers the question.
Thank you. I think so. I appreciate it. And let's see, was there any of the other questions that came through that you wanted to add anything to? Please feel free to, or any tips or anything else that you would want to share.
Yeah, I mean, I think also getting letters of support, because with minority health, focus, we'll definitely need letter of support from collaborators. And, depending on the level of collaboration, is it going to be a plain letter of support or a letter of intent to establish a consortium, especially if you are moving money around from your institution to another institution. Like for me, with all our collaborators, we moved money around, so I needed to have an LOI, executed between both institutions, and considering the time frame, considering COVID pandemic, all the logistics barriers, right? But I think most institutions now have a better process to get things done electronically across the board. So just giving considerations for that and getting as many letters of support as possible. And I mean, there will be situations where maybe you can't get all the letter of support, but at least stating the intention, right? Okay, gather as much letter of support commitment as possible. And then if there are a few that you can get, just, stating those intentions out. I think those will make the application overall stand out, showing that you're really intentional in bringing the information back to the community.
Thank you. Brian, this is, she made me think of something that I know some people have asked about in the past. I believe there's a letter of intent or that you, like a notice of intent or something that you can do to let CMS know that you're intending to apply.
Yeah, so that has passed. That was June 11th, yeah.
But it's not required, right?
No, it's not required.
So if you didn't do it, don't worry.
Right, exactly.
Okay. All right. And then we have another question. This is our last one in the Q&A. So if folks have others, don't worry, feel free to send it. And we'll put in the email address for the grant program too, in case you think of something afterwards. Again, during the funding and opportunity, sometimes we're limited to exactly what we can answer, but general questions or guidance or things we can point you towards, we are certainly happy to do so. All right, Brian, I think this one's to you. We would like to develop a community health worker program, which sounds great, to train students to go into the community to gather and disseminate information to minority populations. Sounds really interesting. They're asking if it would align with the NOFO in terms of getting, I assume, to get funding to do that work.
So unfortunately, this is one of the questions I cannot answer because we cannot answer like specific research questions while the NOFO is out.
Yeah.
Still apply.
Yeah, that's true. And it does take your time and your effort, but we get a good number of applications for how many spots we have, but it's not hundreds. So you'll definitely, your application will be read. So let's see. I would also just suggest reading back through again with the funding opportunity and the website to kind of look through. Our office has done community health worker stuff in the past. I don't know if there was a grant on it or anything that would necessarily assist you, but maybe there's something that would help you connect to the program or connect to the funding opportunity. Hopefully that is not an answer, but hopefully it's helpful.
But it could help assist a little.
All right, well, we can hang out for another minute or two. Brian, would you mind putting in is it OMH grants? Would you mind putting that in the chat?
Over here.
Thank you.
Let me make sure it's to everyone.
Thank you. And then let's see.
And I do answer all questions because they come directly to me.
All right. Brian, I think we have 2 more slides and then we'll pause and see if we can any more questions if you like.
Okay. So there's one more question in here. It says, will the webinar be sent out at a later date?
I believe we're planning to put a recording on the website. Yeah, so it will take a little bit though, just to get this back out. And then there's a second version. If you wanted to join again, or you thought of questions later on, we're doing this again on Thursday.
Okay. Let me go. So before we conclude, we would like to thank Dr. Veronica Ajewole for sharing her research study and MRGP experience. If you would like to connect with Dr. Ajewole, her contact information is listed here. And Ashley, I think that you have the last slide.
Great, thank you. So I just put in the chat is the long version of the URL for the grant website, but you'll also see it posted on this last slide, go.cms.gov/minority research. That's just the shorter version of what I just put in the chat. So we are planning to post the recording on our website. So if you want to go back and look at it again, please feel free. And then there's the email as well that Brian just put out in the chat, omhgrants@cms.hhs.gov. Those are the best two places in that upper left-hand corner there to reach us for the grant program. But you have all of our information here. Should you want to reach out to us for any other reasons, we have lots of listservs, coverage to care initiative, rural health, all kinds of things going on. So feel free to reach out to us. And Brian, he said, checks that email directly. I check one directly, so you will reach a person. Let me just check if any other questions. One person asked about mental health or substance
abuse. So again, I can't answer, but if you see something on the CMS website, then it's probably something that you all could, possibly do research on.
Yep, similar to the community health worker one. We can't necessarily address that topic, but search around to help find connections and things. Always encouraged to apply if you can. All right. Well, I think that'll wrap us up then and conclude. Thank you all so much for your time today. And thank you, Brian and Dr. Veronica and our support team here. We appreciate everyone and hope you have a great rest of your week.
Thank you all.